Now, there are different kinds of treatments that is carried out in the long-term care facility, and it's a wide range. There's personal care where you and the nursing assistants come in, because a majority of your work is going to be about personal care, and that's why you're tested on your skills, and it's important for you to pass them. So this is one of the things that I will be we're reviewing here and coaching, passing your skills. It's very important. Those basic skills: transferring, feeding, ambulating, toileting, dressing. Those are the things that you will be doing. So it only makes sense that you should be tested on them, just to ensure that you do know exactly what you're doing. Other types of care will be wound treatments, will be feeding through tubes. There's a thing at this point I actually like to mention here. Now, we have tubes, the different types of tubes. We have G tubes, we have G tube gastronomy tubes, we have nasogastric tubes, we have catheters. So these are thin tubes which, either are going in, well, they're usually inside the body of the resident or the patient, and they're used to either put things in the body or drain things out of the body. A lot of times, nursing assistants don't know what to do with these tubes. Well, I'm going to tell you right now, nothing. A lot of times, what you need to be doing, your major work, your major responsibility when it comes to tubes, is to observe and report. You're not inserting tubes. I'm going to reiterate this because this is what I tell my students. A lot of people do not know this. For whatever reason, people who've been out in the field, you're asked to do things that is outside of your scope. You need to know what's in your scope of practice. Inserting tubes, draining tubes, or feeding something through tubes is not your job. Neither is giving medication. So you need to know that. So if you do refuse such duties, you're well within your right and you're practicing within your scope. So another thing is physical therapy, occupational therapy, speech therapy. Of course, we have doctors, diagnosis, visiting. So these are all the things that take place in a long-term care facilities. So you need to know these things. You also need to know, to respect them, again, is their space. You're invited in there. So if you're not at all clear what that means, imagine that your home where you live, because when you leave your home to go to work, now imagine, switch it around. Your home is where you work and you're having someone come in to take care of you, or someone come babysit your kids, or even someone come to fix your sink. You have to invite them in and you expect them to respect you, to give you your privacy. They're not going to be fixing the sink downstairs in the kitchen, or even if it's on the main floor as the bedroom and they go into your bedroom. That's just the way it is. Or you don't expect someone who comes to fix your TV to be rummaging through your fridge. Basically, that's how it is, just in case we're not clear. You need to know that in the long-term care settings, this is their home. So a big thing also is, aside from part of the care also is feeding them. Okay, nutrition is very important, and managing the condition. Okay.